Hi and welcome. I'm Dr. Mache, and you are here at Ask Dr. Mache on Facebook Live. I'm one of America's leading experts on women's wellness and menopause. I'm a member of the Harvard Medical Faculty, and also I am the author of The Estrogen Window, which is a best-selling book that has really helped women to understand the timing of estrogen and what can make it safe, when to take it, how to take it, and things that can actually reduce the risk of breast cancer, heart disease, and more. Now tonight, what we're going to be talking about are hot flashes. Hot flashes are a really big topic, and they are the second most common reason that women come in to the doctor for treatments and symptoms related to menopause. And they can really be a problem. And they can affect women in so many different ways. For instance, have you ever been in a situation where you were maybe giving a presentation, or maybe you were in front of a classroom, or you were just with friends and suddenly you just started getting hot and splotchy and sweaty, and everybody knows you're having a hot flash? Other ways it does is, have you ever been in trying to sleep, and then all of a sudden hot flashes just take over and you can't sleep, you can't wake up, and you're taking clothes off and you're putting clothes on, or you have to take the sheets off and your partner is trying to keep the sheets on because they're cold, and it's just very difficult. The other thing it does is it's very disruptive to the quality of your life because it can really impact your work and relationships and a whole lot of other things. And it's unpleasant. Now, hot flashes are really just a release of heat, and basically the brain's thermostat is not working properly. And what happens is that in a few minutes, when I finish talking for just a few minutes, I'm opening this to questions, and I'm here to answer your questions. So if you've got things about hot flashes, let me know. We're going to talk about them and share this information and see what we can do to help turn down the heat. But hot flashes are really the body's way of trying to release heat. And what ends up happening is that the blood vessels in the surface of the body dilate, and they let the blood flow there from the core of the body. And particularly in areas like the fingertips and the toes, the temperature can rise like 5 degrees, and it's an immense amount of heat. And of course, this can be very unsettling for people. And of course, the dilation causes the redness in the chest, in the neck, in the face. That's where they're most common, although they can manifest in other parts of the body as well. And then what goes on to happen is that the body loses so much heat that shortly afterwards, maybe in about 5 minutes or 8 minutes or somewhere down the road, then chills can happen. And those chills can then, you got this intense heat, and then you've got this chill, and then it just feels uncomfortable, and you get very cold, and then you get bundled up again, and the cycle goes on. About 75% of women have hot flashes. There's probably about a quarter of women that don't have them so bad. And they last for a while. They can last, for some women who are fortunate, they may last only 6 months, maybe 2 years. But it's not uncommon for women to have hot flashes that can actually last for up to 10 years. And some women, after they already stop the hot flashes, can start having their hot flashes again when they're 10 years past that menopause. They can start up again. So they're very finicky. They're very challenging for a lot of women. Now, here's the thing about it. There's so many things that can trigger them. And I want to tell you that I have for you, I said in my Facebook Live as I was announcing this that I would have some gifts and things. So I do have a free download that you can get that talks about the triggers that cause hot flashes. And if you go to right here, hotflashgift.com, you can go and download this, and you'll get a PDF that lists some but it's called 10 mistakes that people make that can trigger hot flashes, and you'll find that a very useful guide for you. And I hope you'll take me up on that. Again, it's hotflashgift.com. So anyway, the hot flashes do happen to a lot of people, 75% of people, and about 25% of people are going to have them so intense that they're definitely going to want some kind of treatment. And there are a lot of treatments for it. I wonder how, hot flashes can last for a long time. 1 minute to 5 minutes is the typical. Some people have them for even longer, but feeling like that for 1 to 5 minutes can seem like an eternity. And it can take 30 or 90 minutes up to that for the temperature in your body to really go back down to what's normal. So it's a big mess for a lot of people and causes them a lot of problems. Now, I'm wondering if any of you have situations, hot flashes, tried treatments, things you'd like to share, or questions you have about hot flashes, because I'd like to be able to help you figure this out so you don't have to tough it out. Just a little bit about myself. I have been a reproductive medicine and menopause expert for a very long time. My career started out taking care of women who were infertile, and I did some of the first in vitro fertilizations in the United States. I even helped gorillas get pregnant at the zoo. But there was a paper that came out that said that estrogen, and it was incorrect, by the way, and it said that estrogen caused breast cancer and heart disease and a whole lot more. And as a result, millions of women stopped taking their hormone therapy. And about 7 months after that, my wife had surgery that threw her into early menopause, and her doctors were reluctant to treat her with hormones. And at that point in time, I switched what I was doing from the treatment of infertility, and I used to do sperm to term, and then I went from womb to tomb. So I switched over to the treatment of menopause and all things related to that, and really devoted myself to it, an enormously huge amount of time, effort, years, research, and really feel very passionate, very committed to helping women understand this, because I know what it's like firsthand for my wife to be having to face up to the healthcare profession when they weren't really comfortable treating her at that time. And we know now that for hormone therapy, that just from an article in the New England Journal, we know that now 16 years later after that paper, there are 80% fewer women taking hormones today than there were in 2002. So that's a huge drop. And that also means that the doctors in training over the last years have been very reluctant to treat women, and they haven't had the training and they haven't had the opportunity to work with hormone therapy. Now, let's continue talking about hot flashes, and I hope that some of you will be comfortable to ask questions about it if you've got things that are on your mind, if you are trying to sort things out. There's a lot of ways that hot flashes can impact your life. We talked a little bit about it. One of the ways that hot flashes can impact your life that you may not be aware of is in work and your effectiveness in the workplace. And it's really quite astonishing. But in one study that took place in over 500,000 women with hot flashes, half of them were treated and half of them weren't. And what we found out was the half that weren't treated for their hot flashes were missing on average about 6 days a year, 6 days a year going to the doctor, and they were having a lot of difficulties with their performance at work. They were having difficulty focusing. I remember one woman told me, she said that she spent I don't know how many weeks working on a report that was due. she actually finally got the report done, and then she forgot to turn it in. And she was just so tired, and her hot flashes had disrupted her thinking and her memory and her sleep and the quality of her life. Now, there are a lot of things that can be useful for treating hot flashes. And some of those include lifestyle changes, the foods that you eat, for instance, things like caffeine and alcohol, chocolate. Those kinds of things can actually serve as triggers for hot flashes. And then in addition, there are other kinds of treatments. Exercise is actually very helpful for hot flashes. But it's interesting that smaller amounts of exercise can actually can make it worse, whereas really exercising can make it a lot better. So there's those kinds of things. Stress is another thing that, who doesn't have stress? And the hot flashes themselves cause stress. So it's kind of a self-perpetuating cycle. And in addition, there are issues related to that for treatment that can be done by over-the-counter supplements. There are a number of them out there, and if you have questions, we can talk about which ones and how much and how long. There are also over-the-counter, there are prescription medications that are not hormones, and those are very helpful because they are if you're worried about taking hormones, there's something that you can take that you don't have to worry about the estrogen side of it if you're worried about it, or if you have a medical condition where you can't really take those. And then there's, of course, hormone therapy. And for that, as I mentioned, I have this whole book that goes into all of the details about it, The Estrogen Window, which is published by Rodale and which has reached, really helped a lot of women. I know that I have traveled around the country talking to different women about hormone therapy and about menopause. And there are so many questions, there's just so much misinformation, and people are so confused about what to do. And that's why I'm here with you this evening trying to sort this out, to help you figure it out so you don't have to tough it out. So I hope that if you have a question, I can encourage you to type it in, and let's see if we can be of help to you. Break the ice and let's get started. Actually, breaking the ice would be good, because then we could deal with those hot flashes. We use the ice for that. It's interesting that hot flashes can be triggered by your environment. So if your environment is really hot and you're in a hot place, well, you're much more likely to get hot flashes. And actually, you can lower hot flashes by external environment. So if it's a cooler place, you can do that. And actually, there are there are several products that are on the market that actually are like cool sprays or ice packs or things similar to that that are used in an effort to help with the hot flashes. I see Julie is writing in, and she's saying, any advice for insomnia? Well, I'm really trying to limit this to hot flashes, but let me address your question as you're here, and I want to honor that. Insomnia is a really tough issue because, let's face it, Shakespeare wrote, "Sleep that knits the raveled sleeve of care." People need to sleep a certain amount of time, and as a result of that, there's a lot of things that interfere with sleep, and it depends on if it's problems falling asleep or waking up early and so forth. But there's a whole lot of things, and that's a whole discussion. And if you're interested in a whole discussion on sleep, I can do that. But the most important things, I'll give you some quick tips on sleep, and that's sleep hygiene. You want to go to bed at the same time every night. You want to keep your room dark. You want to limit the amount of television that you have or computer screens, because they have millions of little dots that are pounding on your eyeballs, and you want to try and avoid that. you want to kind of wind down a few hours before you go to bed. Avoid heavy meals at bedtime. There's a whole lot of things. I know when I do coaching and I have people from around the country that are too far to come to see me in my office, and so I coach them by phone or by Skype. And when that happens, I mean, this is one of the common problems. And, you know, you have to talk also about the stresses that are in your life, but keeping the room a little bit cooler. 68 degrees is a good temperature for the room. So those are some things that you can do initially. Let's see. Angela Morgan. I have high blood pressure and get hot easily. How can I tell if it's the blood pressure or hot flashes? I'm 50. Well, I don't know if you've ever had hot flashes independent of the blood pressure medication, but some blood pressure medications can cause hot flashes. As a matter of fact, there are a number of medications that can, and some of the ones are treatments for menopause, including like tamoxifen and raloxifene, which is used largely for bone health or breast cancer prevention. So it's hard to tell them apart depending on the symptoms, but usually hot flashes are coming throughout the day. They happen they're more common in the evening. So they tend, for most women, to happen at a certain time, and they are follow a pattern of this kind of rising heat and the duration that I described earlier, lasting 1 to 5 minutes and so forth. So you have to really just pay attention to the symptoms, how they present themselves, and that might help to tease it apart. Also, if you look in the package insert of the medication that you're taking for your blood pressure, it might be helpful in describing some of the symptoms that are there and help you to tease apart those, whether it's one or the other. Because you might be able to switch off that high blood pressure medication for another one that would be, eliminate the question of, eliminate that symptom so you don't have to deal with it. I hope that's helpful to you. Other questions, please. We're here together, and the average doctor's visit's only about 6 to 8 minutes long, so here's an opportunity to ask questions from an expert in this area. So take advantage of it and ask your questions. So other things about hot flashes that are important to talk about, and that is that some people will use antidepressants to treat hot flashes, and there are a number of them out there. But some of the hot flashes, some of them can cause a weight gain. So if you're using an antidepressant for hot flashes, you have to be mindful of the weight gain because that can be a problem for you. In addition, the facts come up that there are some of the medications that, some of the antidepressants that don't work in certain situations. For instance, there is one called paroxetine, and it is one that affects the metabolism of tamoxifen, which is used to treat breast cancer. So there's a very important pearl for you to know, and that is if you are a woman who has breast cancer, you're taking tamoxifen. And breast cancer patients have a tough time because many times they're either the chemotherapy or surgery. Sometimes they undergo surgery to have their ovaries removed in order to lower the risk of recurrence. Or in some of the women, like the women who have the BRCA or breast cancer gene, they have surgery when they're early, in their 35 or so, and get thrown into early menopause. They are more likely to have hot flashes that are severe. About 90% of those women are going to have really severe hot flashes. And anyway, if they're on tamoxifen and they take paroxetine, which the common name, one of the common names for it is Paxil, that can mess up the metabolism of tamoxifen and lower its effectiveness and actually increase death from the breast cancer. So this is just something to keep in mind. Everything you do has a consequence, a repercussion. So everything is connected together. So it's very important for that for you to have ongoing discussions and try and take care of the sum of you and not just some of you, because everything's connected. And if you put together lifestyle and you put together mental health and you put together your spiritual health and try and control your stress and your nutrition and your sleep, you can really help to improve the quality of your life. Any other questions? We're here and I'd love to help you. If you have specific things that you'd like to ask about, please do. I mentioned that once again that if you want these triggers, that you can go to hotflashgift.com and you can get a free download there of that. And the other thing I will tell you is if you're confused about where you are in menopause, you're trying to figure this out. How do my symptoms compare with others? How much are my symptoms affecting the quality of my life? Well, these are very important questions, and you can get the answer very quickly in a 2-minute quiz that's also free that I've created. It's called menopausequiz.com. If you go to menopausequiz.com, you can take a 2-minute quiz, and as soon as it's over, you'll get your score in the inbox, and that'll help you to see how much your symptoms are affecting you, and also it will help you to see how you compare with other women. You'll get some tips, and you'll get some information that will be able to perhaps improve some of the symptoms that you're having. Now, Angela, how many have you had other symptoms besides these hot flashes? Has other things happened that could help us tease out how far into menopause you are? Where your period stopped at the time that you started the blood pressure medicine? Were you actually in menopause at that time or not? It turns out that the most intense time for hot flashes are actually in the year to 2 years before the final menstrual period, and in the 2 to 3 years after your final menstrual period. And so that's the most intense time. But some women get hot flashes many years before that, and when they're premenopausal, even before the perimenopause. And so they can be having symptoms for up to 10 years before their final menstrual period. But the most intense time is in those 2 years before and 2 years after the final menstrual period. Any other information you can tell me, Angela? Well, Julie, since you're here, if you're listening, then tell me what else about it. Okay, you still have regular periods. This is Angela speaking. Mostly happens during the day. Night sweats seems to be okay for me. Well, night sweats don't happen for everybody, and as I said, the majority of the hot flashes happen when you get really close to the final menstrual period. So it's hard to know. If you're having really regular menstrual periods, it could be the blood pressure medication, although it's not impossible that it's, the hot flashes are related to menopause. Any other questions that you can share? Because I'd love to be able to help you. And I want to stay a little bit longer as long as you're asking questions. And so please do, because that's what I'm here for. I really am dedicated to helping women in this interval of time to try and live a highest quality of life as possible. Because in addition to the over 10,000 patients that I've treated with menopause and going into, through, and beyond, I've also had one very important one to me that I realized sometimes it's very hard to get information, and that can really impact how you feel and feeling stuck. Let's see. Julie, welcome. How old are you? Oh, when do you stop having hot flashes? That's the $64,000 question. Hot flashes can last only 6 months to 2 years, but this is after they start. But they can last for up to about 10 years. Most women will be done by 3 years. The majority will, but about 7% will have them up to 10 years and even longer. So it's quite variable, and they can hang around for a long time. So it's really important to try and understand what triggers them. Try and keep a diary. What's triggering those hot flashes? And as I mentioned earlier, if you've just come on, if you go to hotflashgift.com, I'm giving a free download. You can go there and get 10 mistakes that women make that often cause hot flashes. And I think you'll find that very helpful. Here's Carol. Carol, welcome back. I know that you were here last week. He says, I have panic attacks and anxiety. Well, hot flashes and menopause trigger them. Actually, it can work both ways. The panic attacks and the hot flashes can trigger, the hot flashes can trigger panic attacks, and the panic attacks can trigger hot flashes. So they do kind of feed on each other. So that's something that's very important. As a matter of fact, at some point, because I want to try and do these weekly if we have people showing up. I was doing Ask Dr. Mache by phone as a telesummit. I've done them for about 3 years. I have people calling from all over the world, from Australia, from New Zealand, from Japan, from Europe, from all over the place, Canada, and of course across the United States. And I felt this was a better format, so I've switched over to this just recently, and I'm going to try it. Instead of doing them once a month, I'm going to try and do them weekly, or if life gets in the way, I'll let you know, and I'll do them at I'll find an alternative time. But right now, I'm doing them at 9 p.m. on Thursdays, Eastern. Now it's Eastern Daylight Time, but when women are having mental health, anything that affects your mind, in other words, whether it's panic attacks or if it's a situation where they have more really serious depression, or if they have other kinds of problems like obsessive compulsive or bipolar, menopause really wreaks havoc on that, and it's really important to get the menopause part of that in control so that it doesn't affect these other things. Chelsea says, "Yay, weekly!" So we'll hang in there and see how it goes. Here's Mari, and welcome, Mari. It's nice to have you here. I'm had a hysterectomy about 10 years ago. I have insomnia and hot flashes, panic attack, and night and libido is very low, and I'm diabetic. Well, you have a lot going on, Mari. You really have a lot going on. I don't know if you had it when you had a hysterectomy, if you had your uterus. That's a hysterectomy, is when you take out your uterus. When you take out the ovaries, that's called a oophorectomy, or they take out the tubes and ovaries, it's called a salpingo-oophorectomy. But anyway, those are just terms. I don't know if they took out the hormone-producing organ, which is the ovaries, or just the uterus. But so it's been a long time, and you have insomnia and hot flashes. And the thing is, insomnia goes together with hot flashes very much, because the lack of sleep and stress and all that can cause hot flashes, and then the hot flashes interrupt sleep, and it's a vicious cycle. As you find out, as you listen to these each week, you're going to find that many of these symptoms feed on each other. They're kind of a loop. And when these loops happen, then one thing feeds into the other. And that's why I say repeatedly it's important, it's essential to take care of the sum of you, and not just some of you, because you're the sum of your parts. You're the sum of all you are. And if we can interrupt this part and this part and this, it's kind of like if you have 4 flat tires. You know, if you just fix one flat tire, you aren't going anywhere. But if you can put a little air into all of those areas, if you can just make a difference in all these areas, you can make your whole life move forward at a much better way. So, you know, hormone therapy is very good. I would have to talk to you a lot more to see if that's an appropriate thing for you. But hormone therapy is also very good for the diabetes. As a matter of fact, women who are in hormone therapy have much lower rates of diabetes because the estrogen is actually makes the insulin take the sugar into the cells from the bloodstream much more effectively. So that's a good thing. And insomnia and hot flashes, all those things are improved with hormone therapy. But if not, you've got a number of problems, and each one of these things has to be taken and treated separately, and at least put an effort into trying to take the edge off of one of these problems or the other, so your quality of life is good. It must be very hard for you and challenging for you with all of that going on. So make sure you talk with your doctor. Now, about the libido part, that's a very big problem when you're having, when your estrogen is low, when you're having hot flashes, panic attacks, you're not sleeping. How are you going to feel sexy? How can you possibly feel sexy when all that's happening? So please talk with your healthcare provider about working on each one of these things, and then we can try to tease it apart, and I'm happy to help the best that I can. Angela says, does excess weight affect your hormones? Says, I can't seem to get the weight off easily. Would the weight be harder to lose? Well, hormones actually will help weight loss. It's interesting, women who are heavier have fewer hot flashes than women who are thinner. And that's kind of an interesting fact. As a matter of fact, women who lose weight also lower down their hot flashes. So that's a very important thing. And weight loss can be hard, but menopause doesn't cause weight gain per se. Now, aging causes metabolism to slow down. But what happens is, if you've got all this going on, if your libido's not good, if you're tired, you're having panic attacks, if you go out with your girlfriends and you have a bottle of wine between you in the evening, that's a lot of calories. Okay, so that's going to pack on the pounds. And the thing is many times when women get into menopause, they're taking care of their kids, they're working, they're doing all this other stuff, and they aren't working out. They aren't burning off the calories. So there's a lot to do with your behavior and your actions and your activities and so forth that affect weight. But weight is a big issue for a lot of women. But it's not solely the menopause part. A lot of it is a little bit to do with aging. Your metabolism slows down about 3% per decade. And in addition, the things that happen are that it's harder to exercise, as I said, and so forth. So, and sleep, lack of sleep can pack on pounds, because when you sleep, it's just like in the fall, the leaves fall off the tree. Well, that tree's not dying. That tree is just doing fine, but it needs to nurture itself while the leaves are gone. It's building up the nutrition of that tree. And the same is happening in your body with sleep. And what happens is, if you don't sleep, hormones are produced in your intestinal tract and other places that are actually telling your brain you're hungry. And when you eat, they're not telling you you're full. That's a hormone called leptin that doesn't say, hey, Angela, you've had enough to eat. Your brain doesn't get that message, and so you eat more. But these are important factors. But actually, if you just ate slower, if you just chewed your food for longer and ate slower, just that would give your food time for your stomach to stretch. And in the extra time it took, that 20 minutes would be enough time for your stomach to tell your brain you were getting full. So you would actually eat less if you just ate slower. And then, of course, you got to pick the foods that you eat and so forth. We'll talk about weight control on another topic, on another time. But in the meantime, I think it's very important um, to take into account and honor the fact that weight control is a hard problem. It's a common problem. It's got multifactorial, but it's not just menopause. It's a lot to do with how we live our lives and what we eat. And if you have topics that you want in particular, well, let me know. Put that on, and I'll try and cover those for you, because over the weeks we're going to cover all kind of stuff, and some of them will be general question and answer, but I want to try and keep it focused so we can really get a video that people can come back to and people can look at. And also, while we're here, at the end of it, you'll have a lot. I'm going to go for just a few more minutes, but let me see what Lori is saying. I was having bad hot flashes and bad moods, depression, hair loss, went on the estrogen patch and progestogen pill. I hear it's okay for a max of 5 years. It took me a year to decide to do this. Will be on it until I retire next year, maximum 3 years. Okay, well listen, Lori, as they say, Mark Twain said, all generalizations are inaccurate, including this one. So there's a lot to talk about, and we'll talk about hormone therapy. But in my book, the Estrogen Window, I go into this in great detail. But listen, hormones are a 5-year renewable option. You don't have to quit it at the end of 5 years. You have to evaluate it and see if you can continue it or not. That's number one. Number two, you have to see which one you're on, and it depends on how you take it, by mouth or by patch, or which progesterone you're on matters. All these things go into like a little actuarial formula, and then it can be decided much more clearly for you personally. A lot of times when people are far away and they want to do coaching with me, I do have room for a limited number of people that I coach, that I help out. And it's if you go to menopausecoaching.com, it'll actually take you to a form. And, we can see if that's appropriate for you or not. But anyway, it's there if it's of interest. But there's a lot to talk about hormone therapy and how long to be on it and so forth, because this is a critical thing. But you're not limited to 5 years necessarily. Now, they do reevaluate it, particularly if you're on estrogen and progestin of some kind. It gets reevaluated, okay? So it's a renewable option, but it's not a yes or no. Here's Cindy. She says, I'm 53. Like the thermostats never shut off. My body's overheat. Hot flashes are so bad. My night sweats are bad. It's hard to do anything. So, again, it's a whole discussion of hot flashes. And hormone therapy is really effective. And as I mentioned, there's a whole lot of other treatments. There's also some non-hormonal treatments. There's a new medicine that's just been out a few years called... it's a paroxetine. It's called Brisdale, and it's a antidepressant actually that it's been tried and proven to be effective for hot flashes. It also makes people very sleepy, so it's a useful one to take if you're having problems with insomnia. You just take it at bedtime. That can be helpful. And then there is a new one out that's called Duav, D-U-A-V, like Victor, E-E, and it's a combination of Premarin, the estrogen, with a medicine that's called Basidoxifin, which is a SERM, a selective estrogen, and that Basidoxifin protects the uterine lining. It also is good for the bones and seems to be very safe for the breast. It's actually protective of the breast. So that's another medication. So you need to see about what kinds of treatments. In the meantime, you want to control your weight. You want to check your stress levels. You want to exercise and do things. And exercise is so good. It fends off depression. It lowers the risk of breast cancer. It improves the chances for heart disease. Just terrific, helps you sleep and so forth. Well, I'm going to draw this to a close very shortly. If there's any last questions, please post them now, and then I'm going to stop. I do want to say that I'm going to, we'll do another one next week. I'll have to think about what topic. I didn't hear any feedback from you, so I'll come up with a topic that we'll choose for next week, and we'll talk about that. And in the meantime, let me know if there's things that come up in your mind. If you post it on Facebook, please like this, by the way. If you like this, the Facebook page, then you'll get notifications. Share this with your friends. Here's an opportunity. They can get, they're getting free advice, and it's current, it's accurate, and it'll be helpful. The more I get from you, the more I can give back to you, because I understand what it is you're looking for. And join me on this weekly journey on Ask Dr. Mache, and I'm going to do my best to help you figure it out so you don't have to tough it out. I want to thank you all very much for taking time in your busy lives to show up and to participate. And Angela and Lori, thank you. As I said, thank you all for showing up. I look forward to seeing you next week. Tell your friends, please join. And hey, take advantage of these things. Get your gift. Go over to hotflashgift.com and get this download of 10 mistakes that women make that trigger hot flashes. If you haven't done so already, take the menopause quiz. It takes 2 minutes. It's free, and you'll get some insight into your issues related to menopause. And the last one I'll do, if you're interested to talk with me about things, you can go to menopausecoaching.com. Thank you very much. I hope you have a wonderful week, and thank you for joining me on Ask Dr. Mache.